Welcome to the Culinary Medicine Interest Group podcast. With us today, we have Dr. Ranjan, an attending cardiologist at Westchester Medical Center, and she's going to be talking to us a little bit about cardiovascular disease and how it relates to some of the fad diets that are out there. I'm going to give her the opportunity to introduce herself and also thank her for being here with us today.
Thank you, John. Hi, everyone. I'm Ranjan, one of the non-invasive cardiology attendings here at Westchester Medical Center. My area of expertise is advanced cardiac imaging, so I focus on echocardiography, cardiac CT, and cardiac MRI. And as a non-invasive cardiologist, I also see patients in the hospital and in the office, and a lot of my practice actually does focus on preventative cardiology and nutrition, lifestyle measures, physical fitness, etc. So I'm happy to be here, and thank you guys for having me.
And thank you again for being here. So I think we can start off just by asking you, we've heard a lot about fad diets recently, and they garner a lot of attention in the media and on social media in particular. And they make claims of weight loss, curing health ailments, anti-inflammatory, anything under the sun that people want to hear about, making them healthier. And I wanted to ask you, which of these diets do you think you've seen gain the most attention with your patients in particular?
Yeah, I think social media has certainly played a big role, and a lot of television documentaries or Netflix documentaries have played a big role in how people talk about and think about diet. And so I think I've heard about pretty much every fad diet that's out there, but the most popular ones, I'd say, probably keto diet and intermittent fasting. And I think those are the two that I tend to get questions about a lot. At least I would say once every couple of weeks, I'll have a patient ask me. And I would say specifically the keto diet has gained a lot of popularity more recently.
Okay. And I actually want to ask you a little bit more about the keto diet, because I know that's come up a bunch in various things that we've done as a group. And we know from one of the newsletters that I wrote earlier in the year that it's actually originally created as a treatment for intractable pediatric epilepsy, but now it's become a very popular diet in terms of weight loss. And I wanted to know what your opinions are on the drawbacks of the ketogenic diet in terms of cardiovascular health.
Right. So, I think, again, I'm going to focus on the cardiovascular aspect, as you said, because, again, that's my area of expertise. And so I can't really comment on its benefits and, other aspects of medicine. But I think the biggest problem with any diet is when you think about it in terms of cardiovascular disease, you want to think about what the modifiable risk factors of cardiovascular disease are, and those are, diet, obesity, physical fitness, the use of tobacco, atherogenesis, and development of diabetes, metabolic syndromes, because all of those will in turn contribute to someone's overall risk of developing cardiovascular disease. And so weight loss is really important because, as I mentioned, obesity is one of those factors, and a number of these diets, whether it's the keto diet or any other recent fad diet, may result in weight loss in the short term. But what I tend to tell my patients is you have to think about two things. You have to think about, A, is it sustainable in the long run? Is this something you're going to be able to do for the next 5, 10, 15, 20 years of your life? And B, what are the long-term adverse effects of those diets? So the biggest problem I have with the keto diet is it leads to an increase in cholesterol levels, specifically in LDL. And studies have shown this, even anecdotally, this is something that we've seen happen. And to me, if my patient is successfully losing weight, but I'm in turn seeing their LDL levels go up, that's a really bad sign, and that's a huge red flag. And I always tell them that this is going to impact your cardiovascular health to a much greater impact than just losing weight over a longer period of time in a more sustainable fashion. Because we know that you'll hear all cardiologists focus on this. Cholesterol, LDL, is very, very important. The type of cholesterol and its role in atherogenesis is very important. So I'm I do not advocate for the keto diet at all, at least from a cardiovascular standpoint.
Thank you. And that's really interesting to hear, because it's almost like you have a patient that's trading one risk factor in overweight and obesity for another risk factor in elevated LDL.
Yeah, absolutely. And I think that's why cardiovascular health has to be considered as, you have to think about all of the risk factors of it. So when we say it's important to lose weight, you really can't ignore the fact that, this diet is going to result in an increase in your cholesterol levels. So it all has to be done in a healthy, sustainable fashion. And there's no shortcuts. It has to be a lifestyle change that we end up advocating for. So like you said, you don't want to exchange one risk factor for the other.
So I want to shift the conversation a little bit from what people are eating to when they're eating. And do you think that cardiovascular health is impacted by meal timing or restriction windows, such as with intermittent fasting?
So I'll tell you what we know, Jillian. I think, there's no doubt that caloric restriction has been shown to improve cardiovascular health, and it's been shown to impact a number of things. So when we look at intermittent fasting studies and we look at caloric restriction in general, we know it brings down cholesterol levels, it brings down triglyceride, glucose, improves insulin resistance, it improves oxidative stress, systemic inflammation, etc. The only thing I would say is that there's some evidence based on animal and human studies that intermittent fasting will improve all of this, but also I think what we know is that caloric restriction in general will improve your cardiovascular health parameters that I talked about. So I don't focus so much on focusing on a very strict intermittent fasting diet. I tell them to focus on logging their calories every day, focusing on what they're eating, and trying to bring down the caloric intake in general. Because I think in the way that intermittent fasting, where there's a specific time window where they're not eating, has been shown to have a benefit. Also, if you do something like alternate day fasting or bringing down your daily caloric intake, has also been shown to have the same benefit. So my focus is not so much on the time window, but on the actual caloric restriction.
I've read a lot about intermittent fasting in my own private research just for my own interests. And it's interesting that the literature tends to disagree with itself a lot, and that some studies find that, as you mentioned, intermittent fasting will lower all of those serum markers, and some say that it has absolutely no effect. And a lot of it comes down to, at the end of the day, calories in and calories out, and just a general energy balance of diet.
And I think one of the reasons, John, is because it's hard to study, right? Whether it's the intermittent fasting that's having that sort of impact, or it's just the reduction in caloric intake. And so when you're seeing that benefit across a number of different strategies that essentially do the same thing, and that is measure your calories in versus calories out, then at least my takeaway from that is, really it is the what are the type of calories that you're eating and how many calories are you consuming. And so that's the advice that I tend to give my patients.
Thank you. And I think I want to touch on a couple of other fad diets that I know that we may not have focused on as closely in the questions that we sent you beforehand, but I do want to at least briefly touch on them because they have been gaining some popularity on social media, as we mentioned before. So I wanted to ask what your experience is with the paleo diet with your patients, and any risk factors or benefits that you've noted with the paleo diet in particular.
So I'll be honest, I actually haven't been asked much about the paleo diet, at least recently, but I think the most important aspect of the paleo diet is just that it emphasizes the importance of reducing or eliminating entirely processed foods, right? So they say, and again, we know that processed foods are bad because they have a significant amount of added salt. They're rich in vegetable oils, preservatives, and we know for a fact that processed foods are bad. So the paleo diet tends to focus on whole grains, reducing or eliminating refined carbohydrates, having fruits and vegetables. And so, the way I analyze all of these diets is I try to focus on what they're talking about. It's not so much that we have to go back to the way we lived, or the way our ancestors lived. It's that they're eliminating everything that we know to be bad. And I think makes complete sense to me. But does that mean that we have to say cut everything else out and only have fruits, vegetables, whole grains? I think that's a little bit unrealistic. And so I believe in sort of advocating for moderately healthy diet trends. And so when I talk to my patients and they approach me with, let's say, the paleo diet, what I'll say is, I agree. I think you should reduce or eliminate refined carbohydrates. You should focus on having a healthy intake of vegetables and fruits and avoid anything with excessive preservatives. All of that makes sense to me. If you want to call that, you want to label that specifically a paleo diet and that's how you're going to, that's what you're going to focus on, that's okay. But I try to sort of take away the best aspects of these diets and tell them, okay, yeah, this is why I think this works and this is why I think this is good.
We've done a lot of kind of like work and discussion in our group on the Mediterranean diet. And I think one of the reasons that we find it so successful is because, like you said, it's relatively flexible. It doesn't say like everything is bad, and it's pretty adaptable. Right. So I think in those terms, what kinds of recommendations do you make for your patients to improve their cardiovascular health?
So I would agree with you, Jillian. I actually advocate to have patients follow the Mediterranean diet as closely as they can. Because I thought that was, again, I think nutrition studies are difficult to design and are difficult to take away results from nutrition studies in general. It's hard to do. But I actually think that was the study where they looked at the Mediterranean diet and compared it to just a reduced fat control group was a fat control diet was actually a very well done one when they finally printed their results. So I tend to tell my patients to try and follow the Mediterranean diet as closely as they can. So, lean meats, fatty fish, olive oil. I tell them I try to be a little bit flexible with them because I think that the all or nothing mindset doesn't help. So I try to tell them to stick as closely as they can to this, to reduce the amount of processed foods and red meat, etc. And I think that I have found that to work best with patients. I think when you give them a realistic goal and a clear outline of what they should try and stick to, I think in real life that's a lot easier to follow and apply than being very restrictive in terms of food guidelines.
Do you find that your patients are usually receptive to dietary advice, or do you get a lot of pushback? And what kinds of strategies do you use to prescribe dietary change?
So I think I wouldn't say that I get a lot of pushback. I do think that it takes a couple of office sessions with them to really show them that certain indicators haven't changed or their overall cardiovascular risk is either not improving or is getting worse. And I think, evidence is what helps. So when it's primary prevention and I'm just telling an individual that their diet has to improve or they have to lose weight or they have to exercise more, etc. I think that it's not that they're not receptive. I just think that they forget or they don't have time to incorporate those things. So I often have to do this over a period of 6 months to a year before I actually see change. But if they've actually had an event, if someone's had a stroke or an MI or something's happened, I think that tends to have a huge impact. Or if something's happened to a family member. And the third thing, I think, especially for primary prevention, I think what goes a long way is seeing disease or seeing the adverse impact of something. So I don't know how familiar you guys are with calcium scoring, but I do tend to use a coronary calcium score in a lot of patients where I'm trying to define what their overall cardiovascular risk is. And it's basically a non-contrast, low radiation chest CT, which helps us see what percentage of coronary calcification, what their score is. And so if you actually show somebody plaque in their coronaries, I think that makes a huge impact. And it motivates them a lot more to focus on lifestyle measures or if they need to be on medications, et cetera.
Thank you. I think that's a really interesting point with the imaging study that you just mentioned, just because I think it's very easy for patients to wrap their heads around physical injuries that they can see, but it may not be so easy to wrap your head around a risk factor that you may not be able to see externally and you may not fully understand as a patient. I think that's a really good way to kind of bring it to the forefront and kind of bring eyes to the problem that they're trying to address. On kind of a similar note to Jillian's last question, I wanted to ask you, I know you kind of touched on caloric restriction as a beneficial form of just general health maintenance. And I wanted to ask how you usually address that with patients and what suggestions you make to help them kind of adhere to the idea of moderate caloric restriction.
I'll be honest, I tell them to do what I do in my day-to-day life, and I basically have them download an app. So whether it's MyFitnessPal or some other app that they're comfortable using, I will sit down, we'll look at their weight, we'll calculate what their weight loss should be over the next 6 months. And I'll say, okay, this is your daily caloric goal, and I want you to stick to these somewhat healthy foods. I'll give them rough guidelines, and we'll say, this is what you want to stick to, and I want you to log this every day. In the same way that I want you to log your blood pressure, I want you to log this every day, and I want you to check your weight. And your goal is going to be this many minutes of activity per day, this much weight loss over the next 6 months. And when I see you at my next visit, we're going to go over this again and see how you've done. And so I think when you give somebody, a realistic goal and something that's, not too hard to achieve, but a task where they have to do it every single day, and they're going to be held accountable by their physician at the end of 6 months or so, I think it's easier for them to do that, or at least try to do that. And, if you have a good relationship with your patients, they see you as an ally. And so if they haven't achieved it in the next 3 or 6 months, then you try again and you say, that's fine. We're going to do this over the next 6 months, but we're going to do it because I don't want you to have a heart attack in your 40s. I want to make sure that we've addressed every risk factor we can so that you stay healthy and we're not having this conversation after you've had an actual event. I think that's usually my strategy.
I think that's really great advice, that if you give them something small and concrete that they can do every day, it's much easier. It's much easier to do a small task than it is to do something that seems very large and looming. So I think that's a great perspective, and kind of leads us to our next question, because we don't learn so much about nutrition in medical school. And it becomes this kind of large and looming topic that we maybe have to talk ourselves about later on. And so what are your thoughts on how best to incorporate nutrition education into either medical school or postgraduate education?
I think the easiest answer to this would be to have a module as a part of the cardiology section, or to have a module as part of your other, medicine, subspecialty sections, et cetera. But the truth is that nobody wants additional testing. There should be some testing on it, I think, but I think the best way to keep it interesting and to keep people interested and, to sort of have people remember it is, I think, to have it as some form of a debate. So, for example, this podcast, I think you guys came up with, is a great idea. I think when you have, and the reason I said a debate is, I think when you have two teams or two people stand up and say, well, this is why I think, a 100% vegan diet is better than the Mediterranean diet, or why I think intermittent fasting is better than a paleo diet, et cetera. I think when people get to hear both sides of it, and people really get to hear what the evidence is supporting everything, you will learn it and you will remember it. And the truth is that I think there are very few physicians that really have good knowledge of nutrition. And I think that's probably adversely impacting patient care. So I think it's great that you guys are doing this podcast, because I think that it's really going to help your classmates. But I think another way to do it is, in addition to maybe some testing, I think would be great to have a debate where, you guys just pick 2 or 3 or 4 diets, present the evidence in support or against it. And I think that's the best way to learn.
Thank you. It's actually a really interesting concept that we hadn't really thought of before, but I really like the idea of trying to get students emotionally invested in the conversation. I think that's a great way to kind of bring it to the forefront. And something else I did want to touch on and just kind of call back to is when you were talking before about your suggestions for how to manage getting patients into a slight caloric deficit. I really appreciated how you talked about taking the time to really sit down and explore, even if it is just an app on your phone, taking the time to explore it with your patient can go a really long way, because I can't count the number of times that I've been told as a patient that I need to look into these things, but really taking the time to actually do it with the patient can go such a long way. And I really appreciated that.
Oh, no, I'm glad. And I'll be honest, when you guys sit down with your patients and do it, they will really appreciate it also, because you're right. Most of us don't do it, and most of us don't have the time to do it. But I think, I feel like over the course of our lifetimes, we're going to see primary prevention become such a big part of our practice, because secondary prevention and treatment are just too expensive, and they're a huge burden on healthcare. And we really just need to get a lot better at taking care of patients in the office before they actually get to the hospital. And it's small things like this. We live in a digital age. It makes it a lot easier for us to focus on our health goals. And I think that extra 5 minutes really helps patients a lot. So I really recommend it. I think it works.
Thank you. And to wrap up our conversation on cardiovascular disease, and I know we're lucky to have you back for another conversation, I wanted to ask something a little bit more fun. If you were going to be on MasterChef and you had to present a dish, what would be your signature dish and why?
So yeah, I know you'd sent me this question, and I thought about it a lot because I was trying to think of something that's heart healthy, but also, you know, delicious at the same time. So this isn't entirely heart healthy, but I think it kind of it has elements of what's healthy, but also, you know, also just tastes great. So I came up with baked salmon and a side of ratatouille because it's got fatty fish, not a lot of oil, and a healthy serving of vegetables. So that was my answer.
Thank you. It actually sounds like what I had for dinner last night. Well, thank you very much for your time, Dr. Ranjan, and we really appreciate the conversation, and we look forward to talking to you again.
No problem. Thanks for having me, guys. This is a lot of fun.